If you live in San Diego, you will have probably had your healthcare through maybe your work or through a health exchange or maybe even at school, but you probably would have had your coverage at some point in time at one of the many Sharp healthcare providers, whether that is the Sharp Hospital or even some of the smaller provider networks who are under the Sharp umbrella, like in the North County, Graybill, or Palomar Health 2. So if this is the case, then you might be like, well, which plans for Medicare are going to work with these Sharp networks? So today we are going to help out with my 5 San Diego Medicare plans that work best, in my opinion, with the Sharp Hospital Network. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. Sharp in San Diego as a hospital and doctors network is very well known. It's very well known in San Diego. And I mean, you can't even drive up or down the 5 freeway or even the 78 and miss the billboards, let alone pass one of the many Sharp hospitals or Sharp facilities when you're driving around San Diego. Sharp started in San Diego and it has grown pretty massively over the last decade or so. So as a result, the Sharp Group is a highly desirable network who doesn't just work with any old Medicare Advantage plan, but the 2 main insurance companies that they do work with for the full Sharp network is one of the longest standing plans in San Diego under United Healthcare, and then more recently, the still freshly designed new in-house Sharp Healthcare Medicare Advantage plans that they have from themselves. So these are directly run by Sharp. First up today, I'm going to start off with one of those Sharp in-house Medicare Advantage plans that have been very strong with our clients who are interested in keeping Sharp as their doctor's network, which is the Sharp VIP plan. Now, one big difference with the Sharp Direct plans in general is the fact that they are a wing of the Sharp family of networks. This means unlike the UHC plans, there is not a whole nother set of silos and bureaucracy that things need to go through when they need to get fixed. If you have a Sharp Medicare Advantage plan, they have a smooth line to work with the other Sharp Health side of things. Also, the Sharp Health plan is a pretty boutique operation, meaning that things get done rather quickly because of that small org feel that it has. I mean, there are just a couple of people who handle pretty much everything, which also means that there isn't multiple levels of stamps and approvals and bureaucracies that things have to go through. So it really does almost have sort of like a cottage industry feel to it, which I know I like, and a lot of our clients like that level of agency within the Sharp that the Sharp staff have. All right, so that being said, the Sharp VIP plan is a very nice mixture of benefits and costs. It's not going to be the lowest plan out there on everything, but it is also going to be pretty fairly priced. When we look at the cost of the plan, there is not going to be a monthly premium on the plan, and there's also is not a deductible, so I mean, it's a pretty good start. Additionally, for the out-of-pocket maximum benefit, there is a max amount a beneficiary could spend in the year on their healthcare cost is set at a medium rare level, I would say, at $2,900 for the year. When we look at the cost to go see a doctor, or maybe perhaps a specialist, of course at the Sharp Network, that's going to be a $0 copay as well. For extra benefits on this plan, there is going to be a very healthy hearing aid allowance at $3,800 and an HMO comprehensive dental automatically included and a PPO upgrade if someone wants it at a $40 a month cost. Next up, let's jump over to the UHC side, and they have 2 plans really, which we are going to cover today that are specifically going to be Sharp-centric. And this first one is going to be the UHC Sharp Medicare Advantage Value RX plan. Now, when we take a look at this plan, first of all, we will notice a few similarities, which are completely and totally and most assuredly just coincidence, right? Coincidence, they're coincidences. But the UHC Sharp Medicare Advantage Value RX plan has no monthly premium. Although for all of these plans to be eligible for, someone must maintain their Medicare Part A and Part B Medicare coverage. And there is going to be a monthly premium, at least for the Part B, But in this case, there is not any premium for this plan, and there's also no deductible for this plan as well. And the maximum out-of-pocket for the UHC plan is, surprise face, $2,900. It seems like someone's been cheating off someone's homework. The doctor's visits and the specialist visits are also going to be $0 copays. And that, of course, is all well and good. But some of the areas where the UHC plan is going to be different than the Sharp plan is under those extra benefits. Because there is going to be an over-the-counter benefit, which allows beneficiaries to order things that would typically be available in the pharmacy but don't require a prescription. So if you want to think about it, it would be things like maybe bug spray or bandages, Tylenol. Ooh, my favorite, the swimmer's ear remover stuff. I don't know what that's called. I don't know what the official name of it is, but man, it really helps when you need it. Either way, on this plan, there is a $90 per quarter benefit that beneficiaries can use to order things like that from the pharmacy that don't require a prescription. And although there is a standard basic dental available on the plan that covers things like cleanings and x-rays and fluoride, to get a more comprehensive coverage, folks would have to buy up with an additional monthly fee to the complete dental coverage. All right, next up is going to be another plan from Sharp Direct, and it is sort of the step up in plans, sort of, kind of, and a bit more of a legacy plan, as it has been around for a lot longer than the VIP, but is also going to have some additional costs, sort of in strange places, considering that the first two plans we covered before really didn't have a lot of costs on, healthcare usages. So starting off, the Sharp Gold plan, it doesn't have a deductible, nor does it have a monthly premium. So, it sort of stays in line for all of that. Furthermore, it has a maximum out-of-pocket of $2,900, again, pretty much the same. But it is actually going to have costs for things like doctor's visits. And they are sort of high as far as doctor's visits go, because the primary care visit is at $5. That is a $5 copay. And a specialist visit is at a $20 copay. So it's not that high, but it's definitely noticeable in difference from $0. So yeah. Now, for the differences that are going to be more on the positive side, one thing that will set it apart from the aforementioned VIP plan is going to be the hearing aid benefit, which is set at $4,000 instead of $3,800 every 36 months. So there is a bit more hearing aid benefit on the Gold as well. And lastly, and to the detriment of this plan, unlike the VIP plan, but similar to the UHC plan, there is only going to be the basic dental coverage available and not the full comprehensive coverage that they have on the Sharp VIP. So overall, I think maybe this plan was good when it first came out and just hasn't been updated. So when it was young and hip and cool and living on the edge, but as time has gone by, the benefits, they don't seem as edgy. And it is a good plan. It's a good plan, but except in this situation, there's probably going to be better options at both Sharp as well in the UHC portfolio. As we get to the second to the last plan on this list, and the last one from United Healthcare, or UHC, is another one from United Healthcare that is simply called the UHC Sharp Medicare Advantage Plan. So not too much frills in the name. But then again, what's in a name? Where art thou for, UHC? Anyways, the UHC Sharp Advantage plan is going to follow the established pattern of no deductible, no premium, and access to the full Sharp network. But so far, it is the one with the highest maximum out-of-pocket, breaking with the rest of them at $3,300 for the year. Moreover, the primary care doctor's visits are going to be $5, which isn't really that bad, similar to the Gold, but the specialist visits are going to be at $35, which could be bad because it's sort of high, but it also could be good because, well, maybe they have benefits in other places to make up for that additional cost on specialists, and in fact, they do. But it's definitely not going to be in the dental department because they have just the basic dental. Where things get good on this plan are going to perhaps be one of the most motivating factors is the hearing aid benefits, which allows for over-the-counter hearing aids starting at a $99 copay and then going up. They don't require a prescription for those ones, but you can get prescription hearing aids, which start at a copay of $199 and then go up. So that's pretty good. But the most noticeable part of this plan is going to be the drug coverage. And sure, it covers things like normal drugs, metformin, diabetes, medications, insulins, high blood pressure medications, that one's very popular. And all of that is a standard bill of fare. But the drugs I'm going to point to are the ones that are extra benefits, meaning because of their classifications, they can't be on the Medicare covered drug list, but they are included with the extra benefits. So there are things like vitamin D and vitamin B12, folic acid, and sildenafil, which is the generic version of Viagra. So those extra benefits, those extra medications, they could actually really tip the balance back in favor of the UHC Sharp Advantage plans over some of the other ones we're talking about. All right, last up today is going to be the top of the line of the plan for the Sharp plans. The Coupe de Ville, the deluxe version, not to overstate it. It is the Sharp Platinum Card Plan. So being the top of the heap of the plans, the Sharp Platinum Card Plan does have a monthly premium, which is $51 a month, but it doesn't have a deductible. And the same as all the other Sharp plans, it maintains a maximum out-of-pocket cost for the year for healthcare services at $2,900. So what do you get with the extra premium? Well, for one, the inpatient hospital care is lower at a $150 copay for each of the days for the first 8 days in the hospital. Now, if you recall, for all of you Medicare wonks out there, that when you have just regular original Medicare Part A, that Part A hospital deductible is $1,632 per benefit period in 2024. It'll probably go up in 2025. Even in comparison to the VIP and the Gold Sharp plans, those ones are set at $225 a day. So this one has a lower in-hospital cost. It will still have a doctor's visits copay of $5 and a specialist visits copay for $20 for one's Sharp doctors. And where this plan really shines in comparison to basically all the other ones combined is for its hearing benefit, which is at $4,800 every 36 months. Also, it does include the full comprehensive dental that comes with the VIP plan too, so it's got that going for it too. So does it really live to the platinum standard? That's gonna depend. Is it worth the premium? Maybe. Is it a plan that someone should consider if their Medicare situation fits it and fits their needs and their healthcare goals? Definitely. Overall, looking at the relatively crowded field of Medicare Advantage plans that are available in San Diego that really do cater to the Sharp patients and the Sharp network, whether it is the UHC or it is the Sharp Direct plans, there are some pretty good options. What I ultimately tell my clients about the difference really is kind of 6 in one hand and half dozen in the other. But where the plans do differ is in the type of experience that clients have interacting with the carriers. When something needs to be adjusted or fixed or updated, UHC is a massive insurance carrier. It is massive. And that has a level of stability and conformity to it that a lot of people like. And additional client assistance resources that help out too. Sharp, though, on the other side, is more of a boutique plan with a small organizational feel. That means that things can get fixed easier sometimes, but you gotta know what is the right person to go to get them fixed. Otherwise, you kind of end up running around in circles. But really, whichever option you are considering for your Medicare in 2025 in San Diego for the Sharp network, if you have questions about these plans or any other Medicare issue, please feel free to reach out to us at the information down below, and we'll be happy to assist you over the phone or in person at one of our offices across Southern California, and of course, in San Diego. And we do it in English or Espanol. Also, don't forget to like and subscribe. So for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.